Bom dia a todos. É com grande prazer que nós começaremos em 2 minutos o nosso 11º Workshop Internacional, testes diagnósticos de qualidade assegurada e acessíveis para programas de saúde pública. Assim como nós fizemos ontem, as discussões foram extremamente ricas por trazer essa experiência dos diversos países, das diversas situações em que o diagnóstico é uma das melhores, se não a melhor ferramenta para garantir o acesso a terapias cada vez mais eficazes. Diagnóstico precoce e preciso, de fato, leva às terapias adequadas. E é dentro desse mantra em que o teste certo, para a pessoa certa, no lugar certo, no momento certo, como José Alonso ontem encerrou a sua apresentação, e é o mantra que todos nós no diagnóstico seguimos, nós hoje vamos discutir diversos exemplos de programas de saúde pública, tanto no nível federal, quanto estadual ou municipal, e que tiveram grande sucesso. Essas experiências são ricas e merecem ser compartilhadas. Não só experiências passadas, mas projetos futuros. Convido a todos a que se manifestem durante o evento. Teremos aí possibilidade de responder às perguntas, muitas pessoalmente e outras através do Q&A. Logo abaixo vocês têm o espaço para interpretação, onde vocês podem escolher o idioma mais adequado, inglês, português ou espanhol. E logo na sequência teremos então as primeiras apresentações. Com a câmera? Bom, de qualquer jeito, hoje então nós começaremos mostrando
So we will start by showing you another video, which is another moment of simulation. Yesterday we showed a video with the COVID simulation, and today we have an example for the dengue simulation. The use of rapid dengue tests in moments of a public health crisis as a great tool. This video creates opportunity to have a discussion with different stakeholders that will simulate real life, putting themselves in other people's shoes, as we often say. And the idea here is to understand what are the difficulties that a regulator, public manager, and all different stakeholders face during this journey. So let's watch the video just to give you an idea.
It's estimated of about 100 million cases of such infections occur a year where people develop this acute illness. Underneath this is perhaps another, somewhere between 200 to 300 million cases where people are infected but not manifest any symptoms and therefore do not know about it. But collectively, this 400 million people then allow the virus to then keep perpetuating itself and be transmitted again and again across the world. And so this is what's causing the burden, this sheer number of cases.
So dengue in the Philippines is actually what we call a hyper-endemic disease. That means it just pretty much happens the whole year round. There are some peaks during the rainy season, but we have about 185,000 cases per year. And about just under 1,000 deaths.
During outbreaks, it can overwhelm healthcare systems because so many children or young adults or teenagers or adolescents need to be hospitalized.
There are major epidemics in many countries on an annual basis. Dengue is a major public health and economic problem globally. And the pandemic that's been going on for over 40 years has been driven by global trends, primarily urban growth and globalization.
So not only an increase in numbers, but we've also seen a geographic expansion that now includes a wider span of countries that now report on dengue, including southern areas of Europe, northern parts of Australia, and other southern parts of the US. So this disease needs to be addressed because it is related to globalization and urbanization and climate change. And all these three factors will only exacerbate dengue, and we need to address it.
So this problem is not going to go away. It underscores the desperate need for new tools to prevent transmission of the disease, prevent these epidemics from occurring.
And we need to be able to couple that with a way of increasing population immunity. And the best way of doing that is a vaccine. The first one, of course, is by Sanofi Pasteur, where they used the yellow fever vaccine, which is arguably one of the best vaccines in the world. And yellow fever is related to dengue. And so use that vaccine strain as a backbone, and then just engineered in the shell of dengue virus, the structural genes. So that's the one that's been licensed in most countries, including FDA. Unfortunately, it turned out that from clinical trials that this vaccine doesn't work very well if you've never had dengue before. It works very well if you've had at least one episode of dengue. And so not only does it not work well, then it appears that there may be a risk of that if you vaccinate someone who has never had dengue before, and then when they do get dengue after vaccination, that the chance of getting severe dengue is higher than if they've not been vaccinated.
However, when Sanofi announced the problem with the vaccine, where they actually saw that there was a potential for harm among those who had not yet had dengue, this was actually this caused mass hysteria, and so there were some people who were pretty much poorly communicating the risk.
One of the problems that maybe perhaps a lesson learned from what happened in the Philippines is that the surveillance need to be put in place before the actual vaccine rollout. Otherwise, anything and everything can be easily attributed to vaccination, and that completely derails disease prevention program.
I think a rapid, inexpensive test to determine past exposure to dengue is really essential, especially in the Philippines, to getting people to accept the vaccine again.
I think the key here is trying to get politics out of public health decisions, number one, and number two, better education of the public, education of the physicians, the medical community, education of the policymakers and regulators.
Bom, esse é exemplo de material que é compartilhado antes.
This is an example of a material that is shared before the exercise that then is carried on to try to improve the learning curve among all different stakeholders that are part of this diagnosis effort. Now I'd like to invite Ms. Rosana Pillings for her initial remarks and talk a little bit about the role-playing exercises that we have been doing through simulations. Rosana, the floor is yours.
Thank you, Carlos, and welcome to the second day of the workshop. I think that yesterday we had really fruitful discussions, and I look forward to more of that today so that we could explore options on how to move forward. Now, with regard to this simulation exercise for dengue, I think what we like to do is explore, as you saw on the video, the need for a test to do the pre-screening so that we know who is positive, who had been exposed to dengue to know who's eligible to receive a vaccine. And so in the scenario that we set up, we have a parent who has died, who has a child who died of dengue. And can you hear me?
Yes, we can hear you.
Yeah. And then we feature him talking to his neighbor about the fact that he heard about a vaccine from the news and from social media, and that he said to his neighbor that he should get his children vaccinated, because if he had known that there was a vaccine, maybe his child would still be alive today. And so this is how it would go. And and then when the neighbor takes his children to the doctor would say, well, yes, there's a vaccine, but it's not so simple. Because I think that if the person is not exposed, then to dengue first, then there is a risk that maybe the person who's vaccinated, who's never been exposed to dengue, would be more likely to be hospitalized. But it's a small chance, but it could happen. And now the neighbor is not so convinced, and he said to the doctor, is that test reliable? Should I get it, or what's the, really what's the risk? Because epidemiologically, we may say that it's a small risk, but to a parent, it could be a very big risk. And so then we move to a scenario where the regulators and the policymakers are trying to determine what is the sensitivity and specificity of that test, because there's no consensus so far as to what it is, because the performance of the test really depends on whether you're in a dengue endemic area or a low prevalence area. That performance could be different. And so in the final scenario, they try to listen to a medical expert to explain about that, and to explain what is the best way to not only have the test so that most of the population can benefit from the vaccine, but also that what are the ways that they could mitigate the risk. So those are the sort of scenarios to play out to show that the test is required, but the performance is not uniform across the world. So there's no consensus on what to do right now. And that's a difficulty. So back to you, Carlos.
Thanks a lot, Rosana. Então, dessa forma, vocês podem ver que nós temos...
So you were able to see that we are able to support universities and local community groups in different regions in Latin America, providing support through materials and supporting local initiatives like Leon mentioned was done in Peru, and colleagues from Aladiv do in other countries. The idea is to promote the value of diagnosis through different discussions so people can truly notice how important an accurate and timely diagnosis is for the correct individual in the right setting.